I did a video called How Long Does It Take to Rehab a Distal Radius? And I got this question. I'm going to link that there if possible. But I got this question. Can you give more information about healing with a displaced ulnar fracture? So let me share and answer that question for you. My name is Huang. I'm an occupational therapist and certified hand therapist, and I own hands-on therapy services located in Miami, Florida. So if you're someone suffering with any kind of fracture, wrist fractures in Miami, Florida, I can totally help you. I'm going to include my link below. Now, if you are not in Florida, if you're not in Miami, Florida, you want to take this information and hopefully talk to your surgeon and talk to your hand therapist about it, because fractures, they come in so many different shapes, sizes, and there's a lot of differences in it. So if this is your radius, so your radius starts right here, like one end is right here, and it comes all the way across. And if you feel this bone right here, right, 3 fingers underneath that is where your radius bone is. So your radius affects how your elbow moves, how your arm is able to turn up and down. We call this supination pronation, right? And the bone that's right next to it, if you turn your palm down, you're going to see this nub right here. You see that? You can feel that. That is called your ulnar styloid. Now, this bone right here, if you followed all along, it makes up your elbow, right? That is called your olecranon. Fancy word, but I call that a nub as well. But now this bone right here stays in place, and that your ulna stays in place, and it's your radius that when you're moving turns your palm up and down, right? So now that you have a little bit of an anatomy lesson, let me tell you a little bit about what happens when the ulna breaks, right? So you can break your ulna here at the very end. You can break it anywhere in the middle, and this is called a shaft fracture, or you can break it all the way up here, and this is an elbow fracture, right? So depending on where you break it, it can play a role in terms of how you heal, whether you need surgery or not. I'm going to stick to the wrist. So if you've watched this video, how long does it take to rehab a distal radius fracture, and you're wondering about a displaced ulnar fracture, sometimes what's happening is you might have broken your ulna at the same time that you broke your radius. Now, if you have a ulna fracture, this little nub right here called your ulnar styloid, majority of the time when it breaks, they don't really do anything, right? Now, there's absolutely nothing wrong with that, because there are no muscle attachments to it, right? So it doesn't affect how you move, and it doesn't affect how you put weight through your hand, none of that. So the risk of doing surgery is so much more than the risk of not doing surgery. So if you have an ulnar styloid fracture, majority of the time it's just like a little chip and it's displaced, and they just leave it floating and it's fine. It does not impact your recovery at all. It does not impact your function. You are able to fully 100% get recovery of being able to turn your palm up and down, to be able to move your wrists up and down. Can it cause a little bit more pain? Absolutely. But majority of the time when people break their distal radius, they feel a lot of pain on this side, right? So they tend to, so you break your distal radius over here, people are so surprised that they have so much pain on their ulnar side. And the reason why is because you're going to have pain over there when you cannot turn your palm up and down. Your muscles have to be able to move, and your joint is actually right here in the middle between your radius and your ulna. We have what's called, it's a joint. We have what's called a distal radius ulnar joint, a DRUJ. It's a joint. It's just a flat joint, right? So it's a kind of flat joint. So those two bones have to roll on each other. And when you break this radius bone and you break a little bit of that ulna, your muscles are just like, the joint gets really stiff because you have a lot of swelling. All that swelling creates scar tissue. All that scar tissue makes it really hard for your muscles and your joints to move. So it's like one thing just happening and keeps happening. So this is one of the reasons why it's so important to go to a trained therapist, whether you're going to an occupational therapist, a physical therapist, or if you can find a certified hand therapist in your area. They specialize in hand and arm injuries, just like the ones we're talking about. And they're very good at working with people where there's a little bit more complications than normal, right? So if you're displaced and it's right here, you don't have anything to worry about. You don't have to have surgery to it. The only reason why you tend to have surgery on this side is if you broke it a lot, right? You broke it a lot and it is no longer stable. So then you're going to have a scar or an incision over here. Now, we call them fracture and dislocations. Like if you have a fracture, it's bad enough. If you have a fracture and a dislocation, the two together make for a very challenging recovery. Can you recover? Absolutely. You just need to go and find yourself someone who specializes in these things, and then work with them to continuously make progress. But I can tell you right now, when you dislocate this joint right here, majority of the time they put a pin through here to like help to stabilize that joint, because if it's dislocated it means it doesn't have any stability, and without stability, one, you cannot get rid of pain, and when you cannot get rid of pain, then you won't move, and then if you don't move, then you get really stiff, right? So one way or another, it's wonky, it's not working really well. When you have a pin through there, you'll know because you had a pin through there. They're going to leave it there for a few weeks, and then once you scar down and get stabilized, they'll remove that pin, and then you're going to start to be allowed to turn your palm up and down. So, but scars on this side of your wrist, no fun. No fun at all. It takes a lot of work to be able to move it. One thing that I like to do with anyone that has scars over here, I don't just rub on the scar up and down. You want to make sure that you're rubbing in one direction or another, side to side. And I like to grab it and you can twist the skin. You can move the skin, you can move the scar. There's a direction that usually feels really good compared to the other, and you can start to move it in that direction. Scars are fibers that are all jumbled up, and you want to move in one direction or another because it just moves them either way, and it's going to soften them, and you just have to repeat it over and over and over. It's very repetitive. You break something, you need surgery. The therapy can be very repetitive. You have to do it over and over and over during the day in order to see some incremental results, right? It's not like, oh, you just bumped something, you had a bruise, and then you're fine. Surgery requires a lot more effort, but I think that you'd be willing to put the effort in if you can feel the results, know when and how to expect those results. So definitely talk to your therapist about that and talk about the severity of your injury. Talk to them about what they would expect you to get, because it's different for everybody. So when someone comes into my clinic here, I take a look at their injury, I take a look at how severe things are, and then I work with them week on week to make gains and make recovery. And when we work together, we can say, okay, well, how much, how fast can we go, or how slow are we going, right? How fast or how slow you go is dependent on what you're able to do. You imagine how much time you spend with your therapist, right? It's not that much. Post-surgical, I always recommend a minimum of 3 times a week in order to make gains fast. And then after that, as you're making gains, you can slow it down and cut it down. But if you have surgery, then why would you only go once or twice? You're gonna go so slow that you're not gonna see any progress. My mother-in-law is going through surgery right now, and let me tell you, like, she's getting therapy from somewhere else, and she's like, well, they only told me twice. I'm like, no, if you're not making any gains, like, I'm telling you what I would tell a loved one. You had surgery, there is a timeline that we are working against so that you can, not get stiff, move that scar, get rid of that swelling, and make functional progress. She had knee surgery, so we're trying to get her to walk and be more independent, right? Like if you injured your wrist, don't you want to be able to, cut your food, wipe your ass, put your bra on? I mean, like all those functional things, right? How do you want to go slower? Like I would imagine not. So to me, I'm like, go faster. Like you need therapy 3 times a week. I was like, you tell them. I'm so aggressive. I'm like, you tell them you need 3 times a week. The issue is majority of people cannot do what is necessary to get the recovery that they want by themselves, right? That's the hard truth. You might not want to hear it, but that's the hard truth. You're not able to do it on your own. So go somewhere and get it. Now, is it going to cost you? It might cost you. It might cost you in money, it might cost you in time, but the cost of that is much less than being stuck like Chuck and being at risk for another surgery, because that's what happens when you have surgery and you don't make gains. You are now at risk for having another surgery to fix the first surgery, right? So please don't get me started. So that's the information I have on a displaced ulnar fracture. If it's an ulnar styloid, girl, you're good to go. Like, don't worry about it. It usually doesn't impact your recovery, but if you're not sure, please, these are educational videos. I hope that this provides some kind of value to your life, but please talk to your doctor, talk to your therapist. If you don't trust somebody, find someone else. All right. If you like this video, please like, subscribe, and if you need my help, I'm located in Miami, Florida at Hands On Therapy Services, and I'm going to include my link below. All right. Thanks.